Here's our
As
premiere.
today, anyone who has visited the list of known hotspots should get tested as soon as they can. The full list of exposure sites can be viewed on the Healthy WA website. This morning, one additional location was added to that list, a convenience store on Milligan Street in the city called Grab and Go. There will be a lot of people heading to COVID clinics over the next few days to get tested. This is expected, and we are putting in additional resources at the clinics to help manage the increase. All of our COVID clinics across the Perth metropolitan area will remain open until 10 p.m. at night. People can also get tested at private pathology collection centres, including the various drive-through facilities. The full list of these is available on the Healthy WA website. We're doing everything we can to minimise delays, but people will need to be patient. As experienced across the country and across the world, lines at testing clinics are the norm, as testing someone for COVID-19 is not a quick process. I know it's hot out there, so please, if you're going to get tested, bring some water and wear a hat. By getting tested because you are either sick or have been to one of the exposure sites at the times published, you're performing your civic duty as West Australians, so thank you. The more tests we can perform, the better we can manage this situation. I also want to acknowledge our health staff at these clinics who are doing a great job, working longer hours than they expected at the drop of a hat. Thank you for the service you're providing us all. As I said, it's very encouraging to see people listening to the advice around masks. We need to keep it up for at least the rest of the week. I want to assure West Australians that we have a large number of masks available. I understand there are people who, for whatever reason, have not been able to purchase a mask at this point. Police will be taking a common sense approach in these situations while people adjust to the new rules. The Police Commissioner can talk more to this. Can I thank the police officers for the role they are playing and for helping provide masks to people who do not have one. We're also distributing masks to community organisations to ensure that vulnerable people in particular can access a mask. In terms of travel around the state, as you know, the Perth metropolitan area, the Peel region and the southwest region are now in lockdown. Anyone in these regions should not leave during the lockdown period. People can enter Perth, Peel or the southwest only to access or deliver essential health and emergency services and other essential requirements, or to return to their home. WA Police have established 7 checkpoints in the Perth area and another 8 in the regions. Non-residents currently in Perth, Peel and the southwest are required to remain until the end of the restriction period, unless you meet an exceptional circumstance. Police will ask you to simply justify why you need to be out and about during the lockdown. If you need to travel between regions, please ensure you have supporting evidence, like a letter from your employer or evidence or a medical appointment. For the purposes of this lockdown, like we did early last year, Perth and Peel are treated as one region. So if people do need to travel for one of the 4 reasons, they can do so between Perth and Peel. A G2G pass system for this regional lockdown is in development and is expected to be rolled out later today. This is like the system we had in place when we had regional travel restrictions. We have been here before, we know what is required, and our police are getting it done. I also just want to clarify a few things from overnight. Overall, the message to everyone is to stay home. During this 5-day lockdown, we want as many people as possible to stay home and minimise movement as much as possible. There are 4 reasons only to leave home. Everyone to follow these rules. WA Police have provided a list of essential workers, and it may not be perfect, but for this short period of time, we are asking people to apply common sense. If you must work, and you cannot do it from home or work remotely, you may leave home. but it has to be for an essential purpose. For example, FIFO workers. We have communicated with all companies that no one should be leaving Perth, Peel or the southwest regions to fly up to a mine site this week, with some limited exemptions, especially for specialists required to keep mines operating. We're asking everyone to do the right thing here. Childcare, for example, have been allowed to stay open, but only to provide care for children of essential workers. I have to say, I was disappointed to see some of the vision of people panic buying at shopping centres yesterday. There is just no need for it. As we've always said, during lockdown, people are permitted to visit the shops to pick up groceries. I urge people to be reasonable and only take what you need. Think of our elderly citizens who may not be able to get to the shops easily. There will be enough supplies for everyone. To assist, I can confirm we have permitted Coles and Woolworths to open an hour earlier from 7 a.m. over the course of this week. This is primarily to help older West Australians and to help limit the rush. Please check if your local store is opening earlier, as that is up to each individual store. Can I say it again? The most important thing is for everyone to remain calm and refrain from panic buying. It's completely unnecessary. Also, non-essential retail shops are now closed as part of this 5-day lockdown. On Friday, we announced that WA's mandatory contact register system, Safe WA, would be expanded. This expansion includes businesses such as retail venues, certain types of commercial transport, takeaway services, certain outdoor functions and gatherings, and visitors at all WA private and public hospitals. The changes were due to come into effect from Friday, February 12. In light of the new situation we find ourselves in, the expanded Safe WA system will now come into effect from 6 a.m. tomorrow. Contact tracing is one of the most effective measures in controlling the spread of COVID-19 if a community outbreak occurs, and ensures potential chains of transmission are interrupted. That's why it's absolutely vital that everyone downloads the Safe WA app and use it. You visit one of the listed venues. This will now also include takeaway services. So when you're picking up lunch or dinner, or even a takeaway coffee, you must scan in from 6 a.m. tomorrow or fill out the contact register. To be clear, every venue also needs to provide a paper-based contact register system as well. So if you do not have the app, you can leave your name. We all have a community responsibility to keep one another safe. I also want to thank all businesses for their cooperation to roll out this in a sensible and manageable way. As mentioned yesterday, investigations are underway to find out exactly how the hotel quarantine worker picked up the virus. As you would be aware, we have had a number of reviews of our COVID-19 systems, including from our Auditor General, the National Review into Hotel Quarantine by Jane Holton, which was released by National Cabinet, and the National Contact Tracing Review by Dr. Alan Finkel, Dr. Taryn Weeramanthri, and Lee Jasper. All these reviews found our systems to be sound. However, given the latest incident, a further review of WA's hotel quarantine arrangements, processes and procedures will be undertaken immediately, including any learnings from incidents in other states and internationally, and recent incidents in WA. The review will be led by Professor Taryn Weeramanthri, previous Chief Health Officer in Western Australia and the Northern Territory, and participant of the National Review of Contact Tracing by Professor Finkel. I can also announce today that the WA Police Force will launch a full investigation into how this COVID-19 case came about. We must get to the bottom of what happened. WA Police will allocate strong resources to this inquiry, this investigation. They have the forensic expertise to do the work that is required. This will run in parallel with the review led by our former Chief Health Officer. We will leave no stone unturned to ensure we find out exactly what happened to prevent it from happening again. Thank you. The Police Commissioner will now add some comments.
Good morning. Ronnie, I'll make a comment on a number of matters and then questions no doubt will follow. In respect of what the Premier just announced in terms of a police investigation, I'll call this case 903. That's the number of people that have been infected by COVID-19 since the commencement of last year. The police inquiry is complementary to the Department of Health. To complement their contact tracing, it is not a criminal investigation, but we must know what went on. And with that, this particular individual in case 903 has been very mobile in the community. We need to establish very clearly not only what happened at the hotel, but his movements, when, where and with whom. And that will, I think, certainly assist us in all understanding exactly when and with whom this person was moving. And of course, what initially happened at the hotel. I might comment on a couple of other matters before I conclude. In respect of masks, we've had excellent community support in the wearing of masks. Since this announcement about this time yesterday, I've had no adverse reports about people failing to wear masks, but we do accept, while people are being very responsible, masks must be worn at all times when you are in the community, in public. The rule is, if you're outside your own home, the only time that you cannot or are permitted to be about in the community is if you're the sole occupant driving a vehicle, or if you're exercising and swimming at the time. If you're exercising without swimming, that is, if you're walking, jogging, you must wear a mask. Children under the age of 12 do not have to wear a mask at any time. But what we would complement the public health advice is that if you want to act responsibly as a parent and your children are able to wear a mask, it's a good example, and while they don't need to, if you're able to and the children are willing, then wearing a mask is a good thing. If you go to work, you must wear a mask at your workplace. That is important in terms of limiting the spread. Even in your own office, that is a requirement. The way police are approaching this is that we understand that not everyone in the community has yet got a mask right now. There is a large supply of masks available. It's a big adjustment, we understand, for the Western Australian community, but we're confident that people, in fact I've been out in the community late last night and early this morning, and I've seen all people wearing masks, and we thank you all for that. There will be some challenges, we appreciate that, but one of the hallmarks of the way in which Western Australians have responded over the past year is that police have not had to use a big stick approach with this. I call it policing by consent. The community, if they're not wearing a mask, police will talk to you and approach you. If though you are willfully disobedient and belligerent about that, I call it the knucklehead rule, and if you're not going to wear a mask and one's available, you will get fined. So this is not an excuse for you to say, I don't want to wear a mask. What we're saying is, if you've made every effort and you are on your way to getting a mask for the immediate period of time, we want to work with the community, and that's what happened in WA last year, and we expect the same will apply now. We've not fined as many people as has happened in other places, and I think the way it was approached last year with our community, people have been very responsible. The starting point is really in the Perth Metropolitan and Peel areas and the southwest. That's the immediate regions that are under this lockdown rule. What's the reason for that, and why is it 5 days? On the advice of the Chief Health Officer, this immediate 5-day period is critical, that we limit the movement of people in the area where this case 903 has been out and about, and we know that he's infectious, and we've got advice today of the strain being the UK variant. So in that space, we just need to support the Department of Health and all of the contact tracing, and that's why we're limiting the movement of people. Don't look for a reason to go outside unless it's essential. Yes, you are permitted to exercise for 1 hour within a 5-kilometre radius of your home. You can't drive 20 kilometres to the beach and then exercise. You must only exercise within a 5-kilometre radius of where you live. In regard to the essential workers, There are quite a lot of questions out there because we are putting in place quite a stringent rule around this. Everyone needs to start with the assumption, unless you're an essential worker and you can stay at home, stay at home. That's the clear message. But obviously, essential workers such as doctors, nurses, police, emergency services, but it does also include people that are operating in critical infrastructure, such as in the roads, the construction industry. There's a full comprehensive list of this on the wa.gov website, and that does provide, under the directions, a full list of eligible essential workers. We have, as the Premier has mentioned, strong engagement with the resource sector, and they have advised that they will adjust their shifts, their swing shifts, so that we're not moving people around the state unnecessarily. But I'm amending the directions that I signed last night to ensure that if there's critical, essential work that has to be done to keep our mines and the operations going, that is permissible. We recognise that. We're thanking the industry for their strong cooperation. And what does mean that people will have to make an assessment. If you're unsure, please contact police. The situation in regards to supermarkets, we saw long queues yesterday. I reinforce what the Premier and the Minister for Health said yesterday. Don't panic buy. There's no need for you to panic buy. Yes, there are long queues. We've seen some again this morning. We have deployed police across these supermarkets as much as we can. I've not had any reports of violence or anything like that. But again, this is a lockdown over these 5 days. If you've got enough supplies for that, then don't go out and panic buy. In terms of travelling between regions, as the Premier just announced, and I'll reinforce, we have numerous checkpoints, 7 in the Perth Metropolitan and Peel area, and 8 in the regions. That will also be complemented by random police patrolling. We did see a number of people fined last year when we had these regional patrols, people that are wanting to travel for reasons other than essential work or compassionate reasons. That is permissible, but you must work within the directions. We have in fact this morning turned around some travellers, I understand, that wanted to travel for reasons other than, for instance, holidays. You can't go out of the Perth metropolitan area if you want to tow a caravan and go on a holiday. You must stay within the Perth metropolitan area. The company that has developed the G2G Pass is reinstating the QR codes. They expect that that should be available by this afternoon. Last year, we had nearly 1 million vehicles across the WA internal borders, in which we were able to work very closely with the community, with the truck and freight industry, and the QR code system worked very, very well. So we expect that that will be replicated. In the meantime, please bring with you, if you don't have a QR code ready and available yet, documentation that authenticates your work as a driver who needs to go somewhere for your essential work. And it's very important, of course, that you wear a face mask when you're driving. You can do it without a mask in a vehicle, but of course you need it the moment you step out of it. So everyone needs a mask. And Premier, did you want to take questions before I do? Keep going.
Commissioner, obviously there's some concerns there about what happened with the sheriff in Queensland. How happy are you to keep it in place at a quarantine hotel right now?
Well, look, we base this on the public health advice. What we do know is that since April last year, there has been zero contact that has been between workers at the quarantine hotels that has resulted in any infection. So for nearly a 10-month period, we've had a tremendous system. I think what it is of concern that the Chief Health Officer has briefed us on is that the variant strain here is, on the advice, 50 to 70% more transmissible. So clearly the environment has changed, and that's the purpose of this review. One, as the Premier has announced, will be on a clinical basis, and from the police inquiry is to establish the exact veracity and movement of this particular case.
The regimes there right now,
question whether something's gone wrong in terms of one person being able to cause all this panic? I mean, is there not a chance that there's still problems right there at the hotel?
There is. So that's in fact why the inquiry has been established, and Professor Weeraminthri will complement that as well. He's one of the most experienced public health physicians in the world, so he will complement what Department of Health and the police are already doing. We've had the Finkel review. What this means is that we know there's a transmission that's occurred, and with that we're reviewing it again and again as we must, and we are.
Protocols. What about the protocols that were in place, and are you going to change them? Because this bloke was symptomatic, he didn't come into work, didn't ring any alarm bells, went to a GP a day later, didn't go and get tested for another couple of days. I mean, it's sort of all kinds of stupid, isn't it, when you sort of look at the outcome?
Well, clearly because of what we now presently know, he's contracted this, it would appear, and this is yet to be absolutely confirmed, from a person who's in quarantine. Exactly how we presently, as of this minute, do not know. That's what we need to establish how. We have obviously had some breaches in the past where people have not stayed in their hotel rooms. On the advice that the Department of Health have told us, this particular security guard, there's no present evidence that he's gone into a room per se, but at some point in time it's a highly transmissible virus.
That's what I'm asking, because this guy got symptoms. Took him a day or 2 days or whatever. He called in sick, no one checked on him. I mean, he's a quarantine worker, not a breacher, if you like. You know, are there changes being made now that if someone gets sick who works in one of these quarantine hotels, that they call up someone or someone can do them?
There's a couple of things. One is they're being daily tested now. That finished on the 29th of January, so they're a daily test. He was tested at least 3 times and found to be negative, but that approach has now been ramped up. That's one thing. I think secondly, Department of Health, Police, and of course the independent team led by Professor Weeraminthri will further augment what we presently know and what we presently do. There will be lessons learned as we've found throughout this pandemic, and that is exactly the reasons why these reviews are happening. Sorry, Jeff, if I could just respond, sorry, one bit further. It's clearly not perfect. I mean, we're dealing with a global pandemic, and I don't want to gloss over this as a catch-all answer, but we've seen from what's happened all over the world that we can't just treat this and say, well, that's the system in place and it's going to stay in, like that in stone forever. So we are adapting to the environment and the threat that we're facing.
Confident that he didn't drive, didn't do any ride sharing from that date that you were told?
On the information I checked again this morning with one of my senior officers, we've checked with the 3 ride share companies, the major ones there, and there's no evidence presently that he has driven since the 22nd of January. But look, that's one of those things that we'll closely examine just to make sure and certain. So the sorts of things we do, of course, is review CCTV at service stations and those sorts of places, and that's the purpose of the inquiry as well.
Thank you for the immediate, just back to the immediate kind of changes happening at the hotels. Have you upgraded the PPE to kind of counteract potential airborne transmission at the hotels? And also, I guess on that as well, with the air conditioning, something that's being looked at as part of your review?
Look, I'm aware of some of those issues, but they are Department of Health matters. I can say that there's nothing in the air conditioning systems on the Chief Health Officer's advice. We had a conversation about that this morning, about it being aerosolised. There's no science that says you must have, negative pressure rooms. It's physically not possible in these places. It is, of course, in a hospital setting, but there's nothing scientifically that the Chief Health Officer advises that we need to have negative pressure rooms in every situation of quarantine. In respect of other enhancements, certainly these inquiries will complement what we have in place now that's worked very well for 10 months. But now with this transmission having occurred, we will look at any opportunity to harden and strengthen the existing arrangements.
Share companies that you contacted and you provided an explanation for the 3 petrol stations in 2 days.
Well, that's exactly why police are complementing the health contact tracing. The 3 ride share are the major ones. I'll get some of the pronunciation wrong, but certainly Uber, Ola and Dada, I think are if I've got those names right. We've contacted all three of those. So we will complement the contact tracing, and clearly, as I've mentioned, service stations. But look, I stress again, this person should not be treated as a criminal. He has voluntarily come forward and presented himself for testing. Yes, we've got some questions on the timings of all that, but he's cooperating. And so I'll just stress, police are trained to investigate. We do this daily. This will complement the work that's been done. We don't want to discourage other people from coming forward for testing. It's really important in public confidence that we know. The premise behind this is to establish what has caused the infection to occur. Can we strengthen it further? It's not for the purposes of finding guilt.
Close contacts identified so far, and they all be placed into 2 weeks of isolation. Will they all be forced to isolate for 2 weeks, or only until they return a negative test?
They've all been, well, on the advice we've got, the majority have been placed into isolation and are isolating. As to when we get results on that, I'll have to get Dr. Robertson to be able to respond to that if necessary.
On regional travel, you talked about the checkpoints being in place. What about flights to regional cities, Broome, Karratha, etc.? Will police be meeting them with return back people who don't have legitimate reasons to be travelling there?
Look, we will not at this point in time, but be meeting every flight in the regions. We want to make sure that the infrastructure keeps going, but the major resource companies we've spoken to have been very cooperative. We saw the system work well without any leakage and transmission over the past year in terms of that. And it's in these companies' best interests that we keep all of their work sites clean. That's why I think the cooperation has been very good. But no, police won't meet every single flight. We will where we can, if necessary.
What's to stop someone, say, getting on a plane to go from Perth to Broome for a holiday?
Oh, in terms of that, look, I've got police at the airport. We will, of course, continue to monitor all that, but we don't have it in place, a strict compliance in terms of that, other than people cannot leave their home and just simply go to the airport unless you are authorised. So we will be checking on that to make sure you're simply not going to fly from Perth to Broome for a holiday if you're a Perth resident. So we will be checking on that.
The security guard's place of residence, his neighbours in that block of units are worried, wondering whether they should be quarantining. They apparently didn't know about this until they saw it on the news last night. There are bin bags filled with patient zero's belongings that have been left on his doorstep. Police don't want to move them, apparently. So how do you deal with something like that?
Look, I'm advised as recently as this morning, Department of Health have contacted all residents at that complex. We advise them all to go and get COVID tested. Certainly the inquiries will establish if there's any other information we presently don't have. But if I could just repeat, people that live in that complex, we ask you all to go and get tested. They've all been spoken to on the advice of the Department of Health, and we'll ensure that we do as much as possible.
That are sitting on the doorstep?
First I've heard of that, Jeff, but certainly now we know that, it will certainly cause any inquiries to be made.
The case of Brisbane, where they detected this mutant strain in the hotel and escaped quarantine, they evacuated the entire hotel. Why is that not happening?
Well, I'm not an epidemiologist and public health physician, but there is one infected security guard, and I'm advised that there were a number of infected people in that hotel, 4, I think is the number, that have particular strains that we're concerned about. But look, I'm not the public health physician, so not for me to answer that particular question.
Use it as a quarantine hotel?
Yes, we are.
Is that a plan for going forward?
The health department have not advised me that it's unsuitable, so what we're doing is examining the procedural issues about how the security guard got infected, but there's no information that's been presented to me to say the hotel is unsuitable.
And it's confirmed it's the UK variant, so do we know the exact return traveller that he caught it from?
No, I think Dr. Robertson would be best to answer that question.
Right, any questions for me?
there's a bit of confusion out there about schools that all closed. So what do they do in terms of vocational care or whatever? A lot of people seem to be worried that they're stuck now, they've got their children and they can't do anything about it. Whereas last time I think there were schools that were able to take kids.
Well, we're closed down now for 5 days. This is, at this point in time, a 5-day exercise. Last time, we didn't know how long it would go for. Indeed, it went on for months, as I recall. So it was a very different circumstance. It is difficult for families. I know this will be a difficult position. I've got 3 kids myself. I know it will be hard. But at this point in time, it's 5 days. I'd urge people to work cooperatively and understanding with family members to manage the situation they face. We have kept childcare open for very young children, because we know that for very young children it can be even more difficult, and especially for people that need to go to work.
In terms then of babysitters, are they allowed to come in for those who can't, for example, with their kids with grandparents, are babysitters allowed in, or do they count as visitors?
I don't have the exact details of that. I might ask after I finish the Commissioner or Chief Health Officer to comment on that one.
Dutton was very critical of the shutdown. Are you expecting that?
Well, I hadn't thought about Peter Dutton in this context. I know the Prime Minister and the Federal Health Minister agree with what we've done, and they've said that publicly. So Prime Minister is on the same page with us, and I appreciate his support. In relation to Mr Dutton, I just want to make this point. He's the Minister for Home Affairs. They have the responsibility for quarantine under the Constitution, but he doesn't want to do that. So therefore, it's fallen to the states to perform the role that Mr Dutton should be performing under the Constitution. So he shouldn't be criticising when we're doing the task he should be performing. Under the Constitution, Section 51, quarantine is the responsibility of the Commonwealth. And they have facilities, so Christmas Island, they have defence bases, all of those places, sometimes in very remote locations. They're not doing it. They refuse to do it. So therefore the state's doing it. So I just urge Mr Dutton not to be a critic.
Launching a review that will look at learnings from other states. Victoria obviously did a massive review that reported back in November. Why didn't we adopt any of the recommendations or all of the recommendations from that review?
Well, hold on, we have consistently upgraded and improved our systems over the course of the last year. It's been a consistent, ongoing process to review, improve. We did 3 reviews, so 3 reviews that have found our systems to be sound. Obviously, this event has meant that we will now do a further review to see what else we can do to make sure our systems are sound. And we'll have a police inquiry into these specific circumstances. This is not something we anticipated, although it has happened in virtually every other part of Australia before. But we're now doing our best to deal with a difficult situation.
One of the criticisms, though, was secondary employment. We move now, in the interim, to stop secondary employment, even if you've got to pay the people there more money.
Thank you. That's a very good question. We have been working on that for months. I've requested Health work on that now for at least the last 3 months. That is it is a complex issue to resolve. We're nearing a resolution. We expect we'll get to a resolution in the course of next week. And it may well involve additional payments for people who work in the hotels, in the quarantine hotels, in particular those people who are required to be tested, saliva tested or PCR tested during the course of a week. So that's the resolution we're heading towards. Saliva testing, we decided to do that on January 8. We managed to roll out the system on January 29. So it took us 3 weeks to get the system in place. Bear in mind, it's a big exercise that. Testing basically hundreds of people every single day with a testing regime in each hotel was a big exercise to get there. We've done that, and we have weekly PCR testing. The individual involved, I'll repeat again, was tested on 3 separate occasions and returned a negative test each time in the lead up to him becoming infectious.
Why is it so difficult, though, to say to someone, if you work in hotel security in a quarantine environment, you don't hold a second job?
Well, the advice I have is it's often around enforcement, and we're working with private security companies. So we have been working on it. It has been difficult. We're hoping to get to a resolution next week.
At this stage, do they actually sign something that says, I won't do a second job?
I I'll have to get the chief health officer or the health minister to comment on that.
And we don't work in hotel quarantine, but we can't hold down 2 jobs.
Yeah.
It doesn't seem that difficult for him.
That's right. This individual, just so all of the advice I have, having checked with rideshare companies, is he did not do any second job work after becoming infected. He did not do. Hold on. He did not do any second job work after becoming infected. And also make the point: you can work in a hotel as a cleaner, as a security guard, as a nurse, as a doctor, as a police officer, as an administrative assistant, and you can still go about your daily business. You can still go to shops, you can go to nightclubs, you can go to hotels, you can go to restaurants. We can't control that. We can't lock people up who work in hotel quarantine. They can still go out there and do all that. A second job is obviously something we will deal with, but it doesn't stop people living a life. And that's why we're reviewing the systems inside the hotel to determine what happened here, to see if there's anything more we can do to keep the hotel secure.
Is there any urgency in the review in bringing in these no second job or the daily testing? That was one of the criticisms from the AMA that we've kind of been slowly implementing these things when the virus could be spreading now.
We brought in PCR testing last year on a weekly basis. That's the up-the-nose swab on people. And this person was tested 3 times during January. So that's what happened. In relation to saliva, daily saliva testing, which is not as accurate as I outlined yesterday, but worthwhile, we decided to do that on the 8th or 9th of January. We rolled out the initial trial in one hotel, the